Hi, my name is Erica Smith, and I'm here today to talk to you about a natural alternative for pain relief because medical painkillers are amongst the most common over-the-counter medicines that are used. They're widely prescribed and they'll be found in most households around the world. And so today I want to talk to you about a natural compound called Rhuleave-K. And Rhuleave-K is a compound that's made up with active ingredients including curcuminoids from turmeric, akbar from its boswellia extract, and black sesame oil. And these ingredients together have been shown to be very safe and very effective for the management of pain and to be used any day that you would want pain relief. And typically that's because there's many pathways to pain. If we look at this diagram, we see on the top that curcumin as a herbal ingredient is analgesic, which means pain relieving. Antipyretic means that it can help to bring down a fever. Anti-inflammatory, antioxidant, and actually protects the liver. Whereas you can see there's quite a difference there with paracetamol. In fact, it's even questionable about how anti-inflammatory paracetamol is. It is anti-inflammatory in the central nervous system, but not so much in the peripheral nervous system. We also know as well that it can have an impact on mitochondrial function, so it's not working as an antioxidant and in fact can create oxidative stress, and it also has limited dose capacity for safety because it actually is difficult for the body to detoxify. So it means that there is certain risks with the long-term or overuse of paracetamol, whereas curcumin's been shown to be really safe and effective. If we put curcumin with boswellia, we see a similar kind of application. We find that you've got all these benefits as well as it being liver protective or hepatoprotective, as well as being joint protective as well. And these two have got no known toxicity, and they also have got no known ill effects from long-term use. In fact, they help to support the healing of the tissues as well as giving this pain relief. Now, these two extracts from these herbs, the curcumin from turmeric and the akbar from boswellia, they've got a slightly different molecular structure, so it really does take the two together to get this incredible benefit. And these two molecules work in similar ways, but they chaperone each other throughout the biochemistry. It's like they open the door for each other to really get these incredible benefits, and that's why what we call is that the effect of these together is greater than the contributed effect of both separately. It's called synergy, and that's exactly how this herbal medicine works. Now, there is also another problem with these herbs, though, and one of the things that can be restricting to their benefits ordinarily is that they're notoriously difficult to absorb, and that's why this compound has been put together with the boswellia and the curcumin, has been blended with sesame oil, and it's been put through this incredibly high-speed bead mill in order to break it down to produce this compound called Rhuleave-K. And when these are mixed together, it's called speed tech technology. What it does is that the lipid matrix helps to increase its bioavailability as well as reducing the particle size, so it's micronized. And the ultimate benefits of that means that this compound will start working within 30 minutes with benefits that last up to 6 hours. Let me show you the studies behind this. So this particular study was performed in an emergency room setting, and in this setting patients were presenting with either exercise-induced or work-induced musculoskeletal pain. They had sprains or strains, and they actually required pain relief. So ordinarily they would have been given paracetamol, but in this instance they were given either Rhuleave-K or placebo. Now, the patients didn't actually realise this, but they did sign a waiver because they also had to hang around for 6 hours while they were monitored every 30 minutes so that we could see what the benefits were. And here we can see the ultimate outcome, that pain relief kicked in, within 30 minutes. We could see that they had a full strength pain relief within 3 hours, and that lasted for at least 6 hours, or for long as that was monitored. And that was by taking the label dose, or just 2 capsules of the Rhuleave-K compound. Now you might say, well, that's compared to placebo. That's one placebo group you wouldn't want to be in. So they did another follow-up trial to see how effective it was head-to-head with paracetamol. And what they found is that in this group, a very similar study, same kind of setting, that they gave them the same dose, so it was either 2 tablets or 2 capsules, and here we can see that they got the same kind of benefits with the onset and relief of pain over that time up to 6 hours. And it's just incredible to think that here's a herbal pain relief that can be used as effectively. I know for myself, I've had a cold once where I would have taken perhaps a paracetamol to help relieve some of the symptoms, but I used this instead and it worked just as effectively. So for all kinds of times that you might think of using paracetamol, this would be a suitable alternative. But there's something else that was measured, not just these ongoing, measurements of pain and efficacy, but they also used a special, these trials used a special questionnaire called the McGill questionnaire. And what I really like about this questionnaire is that it doesn't just measure the type of pain, but it also quantifies its severity, but it also shows the emotional aspects of pain relief, because pain really is three-dimensional. And the benefits of measuring this was really showed a profound difference with paracetamol. In fact, Rhuleave-K reduced the affective scores almost 9 times more effectively than paracetamol. And that's really statistically significant. And in fact, what it tells you is that it really does help patients to feel better. Now, when we're in clinic, we like to quantify or track or monitor pain, and we use this when we're trialing out some of our ingredients, things like Rhuleave-K or magnesium and other types of strategies, and we get patients to follow up and monitor on a pain tracker, because it's really good to get subjective and objective scores, and this just happens to be the one that we use in clinic, and I'm sure if you reach out to your sales, you'll be able to get your hands on something like this that would actually help you to get this kind of benefit, so that you can track the benefits you'll see in your patients. Okay, so now when it comes down to it, when can we use Rhuleave-K? Remember, here's all the opportunities, particularly useful for headaches, period pain, obviously all the sprains and the strains, the musculoskeletal pain. But even for those people that suffer with DOMS, the delayed onset muscle soreness, we've all felt this. It usually comes on 12 to 48 hours after doing some physical exertion or exercise. I know that I get it if I haven't done Pilates for a week or two, I've been on holiday, and then I'm all stiff afterwards. So we ran a survey here a couple of years ago. We surveyed an audience, and we asked this audience, for all the classical theories of these muscle pains after exercise or exertion, what do you think the cause of it is? Lactic acid, build up in the muscle, structural damage, that muscle fibers breaking down, oxidative stress, or just plain old inflammation, or all of the above? And a resounding reply from our audience was all of the above. And I've got to tell you, they weren't 100% right. They were only a little bit right, because there's only one that really stands out as the cause of DOMS, the cause of this muscle pain. So if it was to be lactic acid, well, lactic acid is absorbed really rapidly within the muscles within 15 to 20 minutes. I mean, it's not causing a pain 2 days later. It's not associated with muscle damage. There's no evidence for that. Oxidative stress, maybe, but you know what? Antioxidants don't work. But inflammation is actually the one thing that is shown to be the true cause of inflammation. And so even then, how come the muscles get so sore? Is it the muscles? Interestingly enough, there's a hidden sensory network all throughout our musculoskeletal system, and it's actually the fascia that wraps around. It's that connective tissue that wraps around like glad wrap around the muscles, around the muscle fibers. And it's been shown that it's really richly innervated, which means that's where the pain receptors are, because the muscles themselves don't carry pain receptors. It's all within this fascia. And in 90% of all cases of muscular pain, it's really this fascia that's causing it. And the only other place that you would feel it would be in the joint, the muscle tendon junctions. But in 90% of the cases, it's all around this fascia. So the fascia is considered to be this hidden sensory network. And so there is actually a herb that's got some evidence on it to actually help to reduce DOMS and to reduce this inflammation that's felt throughout the fascia. And this was curcumin. And of course, this is in Rhuleave-K, and it gives us another application for aches and pains. So this particular study, they pulled the analysis from 4 different clinical trials. They found that for really fit and healthy, strong and exercised patients, only a small benefit, but it helped a bit. But the people who got the biggest benefit from relief from DOMS by using curcumin was if the pain and stiffness, the people who got the biggest benefit were those who were unfit, untrained, just starting out in exercise. The very people can be restricted from exercise because of their fear of the pain. And this is a perfect application. So if you want to get people back to exercise, get them living their best life, Rhuleave-K is going to be a great opportunity for them. So just thinking outside the box, there's certainly some good applications and evidence. So if you're thinking, is there anybody that I need to be careful of for recommending this to? Well, here's some safety considerations. I just want to say, obviously, if anybody has allergies or hypersensitivity to curcumin, boswellia, or to black sesame oil, it's pretty rare, but same with anything. If people are allergic, keep away from it. There's no particular contraindications, but there are just a few cautions. If you've got patients who are taking anticoagulant or antiplatelet drugs, because there is an anti-inflammatory activity here, then just monitor those patients, and hopefully you can get them just taking 1 or 2 doses a day. They should be okay, but we say not to exceed more than 3 doses a day. But it's certainly going to be safer than doubling up on aspirin. So if you've got patients with bleeding disorders, you can actually use it, but discontinue it if acute bleeding occurs. So just really it's about monitoring your patients there as well. And if you've got patients who know they're going into elective surgery, just discontinue the use of it 4 to 7 days beforehand. It's just a caution. It's not necessarily a massive contraindication. Now, the reason that it's not recommended in pregnancy is simply because there's not enough clinical data for us to be able to say, yes, it's 100% safe. But believe me, there's nothing much to recommend non-steroidal anti-inflammatories or paracetamol during pregnancy. So we can't recommend it. But just consider things like your fish oils, your SPMs, or magnesium. You've got some other good other options to be able to consider there. And the same thing with breastfeeding. So work with your patient, monitor them, and you'll know that you actually do indeed have something pretty safe. We also have a couple of co-prescribing notes for you to consider. And the other things are that if you've got patients who have got chronic pain and they're using adjuvant therapies or add-on therapies beyond pain relief, they could be using antidepressants, anticonvulsants, all this list on the left-hand side. The only one is that to take a special caution with is anticonvulsants, and that would be if they're taking them for epilepsy, because the boswellia may affect the half-life of the medications in that particular class of drug, anticonvulsant drugs. So if they're using the anticonvulsant for pain management and they're not epileptic, just monitor them. It's a very low-level caution, but if they're using anticonvulsants for epilepsy, we wouldn't recommend it. There you go. So there's our combination, and this really is an exciting thing to be bringing into practice. A lot of people either are at risk of overusing paracetamol, non-steroidal anti-inflammatories. Quite often they get a run-out effect of those. They don't work so effectively over time. Well, now we can bring in this fantastic compound called Rhuleave-K and really help those patients on a day-to-day basis, safely, effectively, and even if they've got DOMS. Nice to meet you. Thank you.